Welcome back to our Blue Sea Water channel. It's been a while since I've done a video. That's been going on, and there's quite a few videos I'd like to do. I had a very, very extreme dental surgery about a month ago, and I engaged a ton of my resources in the recovery process, and I'm really quite appreciative of where I'm at today, 1 month later. It seemed like an impossible mountain to climb at the time. Just briefly, I had a wisdom tooth up here, a cyst in my sinus. And I got an abscess, so they had to pull two teeth here, go up into my sinus, drag out the cyst, and drag out the wisdom tooth. So this was quite a shock on my body. And by the way, I just want to go over kind of a post-op overview of how I process what I do. This might help. First of all, post surgery, I didn't have time. I was in the surgery within a few hours. Uh, there's in this town, there's no biological dentist. So after the surgery, I did talk to a few biological dentists I knew out of town. So I understand how the process would have gone different if I had gone to a biological dentist. I had an excellent surgeon. So the typical thing is to do the surgery and put you on very strong pain meds, which was one problem post-op, oxycodone, and then this was an extreme surgery, so I was in a lot of pain, and then antibiotics. And my surgeon actually wanted to flood me with antibiotics for 20 days. I stopped after 7. Now, the challenge is, number one, shock to the body with any surgery. So what do you do for shock? Number two, for me and anybody who's done a lot of holistic work, wrecking your gut flora is no picnic. So how do you build that back? Number three, oxycodone, I found out, messes with the brain. I wasn't on it very long, but even the recovery from that is another process. So if I had gone to an ozone dentist, they would inject ozone into the whole region before the surgery, during and after. You go back every day, and this would, number one, reduce tremendously the potential for infection, injecting in the gums. This is, by the way, pretty easy to do. I actually did this at home after the surgery once this ozone doctor showed me how. It's not complicated. I have an ozone system. So if you own a home ozone system, and doing injections is something you can learn. I'm not advocating anybody do that, but I'm just saying it's not as difficult as you think. So bottom line is, if you go to an ozone dentist, this flooding the body with ozone through injections, you can do ozone olive oil, go back every day, get ozone shots. You would need way less pain meds. According to this ozone doctor, a couple of ibuprofen, but it would vastly reduce the pain, minimize the risk of infection. And this is why one would do ozone. We're going to be interviewing Dr. Eric Zeminski today, actually, and we'll be going over what biological dentistry is. So this is sort of my overview looking back. Of course, looking back, everything is so clear. What I did do is, right before the surgery, I infused nasal ozone up my sinus cavity. I did that. I just flooded my sinus cavity with ozone. I did it through the ears to get to the brain. The dentist was concerned with issues of infections of the brain and sinus. So, of course, this dentist doesn't know anything about ozone. She's very nice, but I couldn't say, well, guess what? I'm going to go home and flood my sinuses with ozone. So essentially, if you own a home ozone system, then you can post-op, if you have surgery, do your sinuses, go through your ears, do your brain. You could do this whole body systemic through rectal insufflation, and this is excellent. You can essentially set up a anti-infectious protocol. I did this. I did rectal, sinus every day, brain every other day or so. I flooded the socket. I just took ozone, held my breath, and just blasted it into the socket every day. So this is part of my recovery protocol. And then when I got the needles, I did do an injection. Now, it's difficult to inject yourself, I would say. Up here, I was able to manage. Obviously, it'd be great if you had somebody who could help you. But flooding the socket, doing the sinuses, doing the brain, doing this whole body systemic rectal, excellent for any type of antimicrobial therapy. So if you have sinus infection, obvious you do nasal insufflation ozone. If you have issues with your brain, ear insufflation, and to flood the whole body, you do IV or rectal insufflation. So this I had in tow. This was just standard fare for me. So this is part of the recovery process. The only difference is if I'd known about the injections and I knew somebody like a nurse practitioner who was trained in it, I could have gone every day, hired somebody or whatever, and literally done the injections right before the surgery, done injections every day. This would be just taking that ozone to a little deeper level systemically at the tooth level. So I did pretty close to the next best, which is flooding the socket, just blowing ozone up in the socket, doing the sinuses. So I did a pretty good job, given that I didn't really know about injections at the time, but that would be my lesson learned. So I would encourage everyone, first of all, to be ready. Now, why do ozone at home? Because any infection, you get a radical sinus infection, you get COVID, you get anything. If you know strategically how to use ozone, you're locked and loaded, ready to go. Boy Scout always prepared. It is the #1 antimicrobial therapy. Now, we have an antimicrobial program. We'll post a playlist below. There are adjunctive therapies that go with the ozone that make things work even better. #1 would be what we call the mission coil therapy. It's highly antimicrobial, synergizes well with ozone. The problem with ozone is you first of all need to strategically understand how to do it. If you really have heavy duty stuff, you need to flood the body with a lot of gas. That can be highly aggravating. So you need to learn how to do this. With the mission coil, you come in after you do the ozone and you create an antimicrobial field, which you can actually do for hours if need be, and just keep supporting this antimicrobial push on the body. Now, there's way more to dealing with infections. #1, you have to redesign the gut. After wrecking my gut with the antibiotics, I did my own program, which I do with everybody who has a wrecked gut to begin with. I did a lot of ozone, and I have high-end super soil bacteria probiotics on my website. I loaded up on those, and this was an actual beautiful test to see how good this program is, because I never started from zero. I haven't done antibiotics in a long, long time. So this was starting from zero. And essentially, the bottom line is, it took me 3 weeks to build back my gut. Some people said it takes 6 months. It took me 3 weeks. I did an intense regimen of our Venom product, which is from Russia. It's a super soil bacteria product, and the Microbiome Restore. And I even have a third soil bacteria product. And they're all, the 2 of the 3 probiotics are not just soil, they're soil with other strains of probiotics. So I did this basically combo regimen of these high-end probiotics that I really like, along with ozone, along with pH kind of balancing, aloe vera juice, a whole slew of supplements designed to rebuild the gut. So I'm impressed that I could basically in 3 weeks' time get things back. This is a really beautiful testimonial to my own program, where people call me all the time and they just have horrible gut flora, gut immunity, they have leaky gut, et cetera, et cetera. Okay, so the oxycodone messes with your brain nerves. So I was doing the mission coil on my brain, I was doing PMF on my brain, I was doing hydrogen therapy, and we'll get to that in a minute, and ear insufflation ozone. I know a doctor in Mexico who specializes in ozone and cancer. He told me you could do, and by the way, this is something you don't do right away. You have to acclimate to this therapy, but he said you could do 40 minutes of ear insufflation ozone. That's a lot of time flooding the brain through the ears with ozone. So this is an amazing therapy for anybody who has brain issues in general. It's going to go in there and really clean house, fire up the cells, get things going. I recommend anybody who's getting older or has any brain challenges to learn about ozone ear insufflation and how to treat the brain. Hydrogen is similar to ozone in that it's a gas. It's very permeable. In fact, it's the most permeable gas of all gases because the hydrogen molecule is so tiny, it goes through everything. So it goes everywhere in the body. The key with hydrogen is you have to put the time in. It takes time for you're breathing it through a cannula. You can apply directly, or you can drink the water. Those are three options. But therapeutically, when you're breathing it, you really need the right amount of gas, high volume gas, and put the time in. So I was doing hydrogen after the surgery 24/7, literally. Now I typically breathe hydrogen all night long anyhow. So this is profound on cellular rejuvenation. It's not something that's going to knock out an infection, but it's the number one therapy, cell systemic, for homeostasis, helping the body heal, flooding the cells, and anti-inflammatory therapy, oxidative stress anti-inflammatory. The beauty of hydrogen also is that if you're doing high dose ozone, which is extremely fiery, inflammatory, it's a pro-oxidative stress therapy. You can use the hydrogen to essentially support the reactive process you're going to go through when you do a lot of ozone. So you can essentially tolerate higher doses of ozone if you're doing hydrogen. So anybody who's really serious about ozone therapy, hydrogen therapy is a must. We have a system, we'll post a link below, tons of information, and it's basically very affordable for the amount of gas it puts out. It puts out a lot of gas, great price, great designer, excellent system. Okay, so this seems like a lot, and I just want to go through the list just because if you're really serious about holistic medicine, maybe you can appreciate all these therapies, what they do. In addition, I joined this new wellness place in Albuquerque. I've been doing cryotherapy for years. The old place shut down, and I was looking around. I found a new place, and they do some key therapies that I like to do on a daily basis or every other day. One, of course, is the cryotherapy itself. Cryotherapy is literally going to a chamber that's close to -200 for about 3.5 minutes and doing a tremendous deep cold therapy. This is anti-inflammatory max. Athletes go in and do this. It's like an ice bath. Google Wim Hof, you can look up the beauty of cold therapy. But essentially, I've been doing that for years. It's great. Along with hydrogen, tremendously anti-inflammatory. The other thing is infrared. It's actually infrared, near infrared, and mid-infrared sunlight and system. I go in there, sweat out a bunch of toxins. The light frequencies permeate about 3 inches into the body. The infrared does. Very kind of detoxifying, especially after all the antibiotics and the oxycodone. So my vision for infrared, detoxify, detoxify, detoxify. Everybody needs to detoxify. The other therapy they have over there that I really like is called red light therapy. This is very good for the brain, getting those lights deep into the brain, the red light therapy. So I also do some compression. They have IV, but these are the main therapies. So I just want to go over kind of a quick list, kind of what I use tactically, like going to war to recover from the dental surgery. Number one, ozone for infection, keeping the body anti-infectious, the sinus cavity, which was a complete mess, the brain, the whole body systemic. Number two, hydrogen. Flood the body with hydrogen, help the cells heal. Just very, very profound for a very challenged body. For shock too. By the way, for shock, I did arnica, rescue remedy. Resetting the shock biorhythm is very important. So you can use homeopathy, You can use flower remedies, botch flower remedies. By the way, another thing that I did on a daily basis, which I always do, is my vibration therapy with rapid release. This is essentially self body work, lymphatic system, organs, fascia. You can look at our vibration therapy program. This is just ABC. I do this every day. It's self body work. Body work meaning fascia. I did craniosacral, so you understand you're working on the bones, the connective tissue, you're working on the lymphatic system, you're working on the organs. Great, easy therapy to do. The machines do a wonderful job. 15 minutes, you could do a miraculous self-treatment. A must for anybody who appreciates what it means to work on the organs, the lymph, trauma. The nervous system locks down when you get on a vibration machine and helps shake free the nervous system. Okay. So we have hydrogen, ozone, vibration therapy program, sauna for detox, cryotherapy for inflammation, red light therapy for brain healing. Again, why I heal the brain? Because the oxycodone messes with the brain. Detoxification through the ears, get to the brain with ozone. Now, on top of this, of course, I'm doing a ton of supplements, various supplements for the gut. We went through the probiotics, critical for gut rebuild, post-antibiotics, antibiotics, rectal ozone, antibiotics, probiotics, not antibiotics, probiotics, ozone, purify the colon, dump in the probiotics. You have to kind of learn to be self-aware of your body's systems. You have to sort of do a self-assessment and try to learn how to do this. Be aware of your gut integrity, be aware of your lymphatic system, be aware of your endocrine system, be aware of your stress trauma level. Speaking of stress and trauma, just before the surgery, I had started using something called the Possetto vagus nerve stimulator. This helps with anxiety, stress. It defibrillates, I describe it as a defibrillator for the vagus nerve. Why grab the vagus nerve and kind of shake it free, loosen it up? Because it innervates every organ in the body, the brain, the liver, the colon. So this is telling, it's like a central nerve going everywhere. And when you ring it with this device, it helps the system go from this to kind of like this. So everything kind of integrates better, communicates better. This is a therapy that if you have a lot of stress and trauma, please look at our video we did on it. Alrighty, so if you understand these tools and what they do, now somebody might say, I can't do all this. Well, this is about your self-commitment to your own health. Now I'm 69, I just turned 69. I always want to say, if you want to learn about anti-aging, talk to somebody who's old, and also talk to somebody who's been in the field for a long time. Now, one thing for me that I understand deeply from doing a ton of body work is the whole, what's called Chinese medicine, qi, stagnation, qi concept. What is qi? Qi. This has been central to guiding me to all my therapies. Because if you can assess all the systems through pulse taking, through body work, and you're really, really deep in the field, this is a much deeper game than people understand. All right, I appreciate it. Any questions, contact me, Andrew@blueseawater.com. Thank you.